Good afternoon, everyone. Hello, hello, hello. Glad to be back here today. Some of you may have noticed that I posted earlier today about this live, and today I am going to be chatting about vaginal moisturizers, some options for moisturizers, what moisturizers are, who may benefit from the use of moisturizers, and I'll just go over a few different options for vaginal moisturizers that are available on the market. But before I start, of course, just wanted to reiterate that this video is for information purposes only and for education, and it isn't meant to replace your doctor's or your specialist's medical advice. So if you have questions or if you feel like some of this information might be helpful for you, you can always check in with your primary health provider or your doctor. Also, I am not being paid for any of the products that I'll be discussing today. These are just some of the products that I have found helpful and clients that I've worked with have found helpful. So just sharing some information just for general learning, okay? So we'll get started. First of all, let's chat about what vaginal moisturizers are. Now, vaginal moisturizers, first of all, are non-hormonal products that can be used to help improve and maintain the moisture within the vaginal tissue. So, first of all, when I'm talking about the vagina, again, the vagina is, if this is our vulva, the external genitalia is the vulva. Here we have the clitoris at the top. This is the anus at the bottom, the labia in this area here and here. So this all is external, and this is the vulva. When we talk about the vagina, we're talking about the internal tissues. So these are products that are used internally to help maintain moisture internally in the canal. Now, some people will use it sort of at the entry as well, and that can be helpful. The vaginal moisturizers are for internal use and can be quite beneficial for a few populations. I decided to do this video today because, as y'all know, we're still in menopause month in October, and those that are sort of in that stage of life or that transition to menopause, whether it be right before menopause or perimenopause, menopause and postmenopause. Many of you are likely familiar that around that time in a woman's life, in this transition, the tissues around the vaginal area start to change. The lack and decline in estrogen actually can create a lot of dryness and irritation, chafing, itching, and discomfort with penetration or any sort of insertion or intercourse. So vaginal moisturizers can be quite helpful for the menopausal or perimenopausal population. Another population that may find it helpful is those that have had cancer treatment and are finding a significant amount of dryness and inflexibility in the vaginal area after management and treatment for cancer. So that can definitely be another population. Some individuals in the postpartum, especially in the early postpartum, when a woman is breastfeeding or chest feeding, when an individual is, breast or chest feeding, this alters sort of the balance in hormones within a person's body. And so, early postpartum can actually mimic almost like a pseudo-menopausal state in the vaginal tissue. So a lot of those the changes that happen around menopause, some women may experience in the early postpartum. So that dryness, sensation, sensitivity in the tissues of the vagina. So those are some of the sort of main populations that I have found using vaginal dilators are quite helpful for. Now, if we are talking about vaginal moisturizers versus lube, this is another question I often get is, what is the difference between a vaginal or personal lubricant and a moisturizer? And there are some differences, and the way I like to sort of remember this is that lubricants are for love and moisturizers are for maintenance. Okay, so what I mean by that is lubricants are really great for sexual play, sexual activity, and intercourse. They're very fast acting, but oftentimes they're not long lasting. So lubes are great when you're being intimate or sexually active, and using that will be quite effective to reduce dryness, irritation, friction. However, moisturizers are a little different. Moisturizers are used more for maintenance. So individuals that use moisturizers, it's meant to be used, inserted, and it actually allows moisture to maintain within the vaginal tissues over time. So the moisturizers, because they're used for maintenance, you got to think of them almost like when we moisturize our face or our bodies, and we do that on the regular, or some of us may, and that's something that we try to maintain for the health and the suppleness and minimizing dryness to the skin on our face and on our bodies. So we want to think about vaginal moisturizers in a similar manner as far as the way we use them. Okay. If you have any questions, of course, please put them down in the comments, and I'll check them every so often just to make sure that I don't miss anything. So that's what a moisturizer is, versus a lubricant. The other thing to note is that moisturizers are non-hormonal. So especially around menopause, when you visit your doctor or gynecologist and you're struggling with vaginal dryness, there are different options. There are non-hormonal options, and then there are hormonal options. And hormonal options typically, again, are sort of inserted within the vagina, whether there's a use of a hormonal cream, a hormonal suppository or tablet that's inserted, or creams that are sort of inserted within the vagina. There are some options of devices or rings that are inserted vaginally that remains in the vagina, like an estrogen ring that can also release estrogen to help with a lot of these changes that happen in the vaginal area. So this is something that, again, with regards to hormones, that's something you can speak to your family doctor, your gynecologist about. Some naturopathic doctors also are well versed when it comes to hormonal options. So that is the hormonal route. When we're talking non-hormonal, we are talking about vaginal moisturizers and vaginal lubricants, because they can still help with some of these dryness and itching and chafing issues that individuals tend to struggle with, especially around menopause. So there's a question with regards to components that differentiate lubricants and moisturizers. So Renee, that's a great question, and it's actually not really standard, from lubes to moisturizers. I am going to speak about one specific compound that I tend to find more of in moisturizers. So hold that thought, I will get to it, okay? All right, so let's talk about different types of moisturizers. Now, there are quite a few different types on the market. I'm just going to share with you a few of the more common ones, at least the ones that I tend to see here in Canada, and maybe a little different in other parts of the world. In the US, we probably have all these options as well, and perhaps even more. So the first one I'm going to talk about is Replens. So Replens is a vaginal moisturizer. It comes in a box like this. And in the box, you're going to see a little tube like this, as well as a syringe. Okay, so this specific type of moisturizer is sort of like a gel or cream base, and you put the the actual Replens moisturizer within this syringe, which pulls back. This syringe is inserted vaginally, and then you just sort of syringe it in just like you would for, I don't know, baby medication or anything you would put in the syringe to inject. Okay, so it's essentially you manually insert it and then inject the components of the moisturizer vaginally. Replens is a very, very common. You can find this pretty much anywhere. Here in Canada, they tend to be available at pharmacies, drugstores, even some of our local grocery stores will carry Replens. Some individuals like Replens. It is a gel consistency, so some of the cons, because it is jelly and a little bit more viscous, it may sort of seep out. So for a lot of these options in moisturizers, I actually advise clients to use them in the evening, because that tends to be a time when you're not going to be upright up against gravity, so that way it can kind of just sort of sit there and do its thing and do its work. So that is Replens. The one disadvantage I find with Replens, and this is not from my own personal use, but just from other individuals that have used this and from other people in the industry, is that it can be a little irritating for some individuals. I believe there is glycerin, and if you do have sensitivity to glycerin or parabens, then it may not be the right option for an individual. So if you're not sure, you can always just try it. Some people will try some of these creams and moisturizers either on their wrist here, or just on the external tissue on the vulva before they try to use it internally. And if there's no sort of negative response or adverse response on the skin, then they'll go ahead and use it internally. Okay, so that's Replens, and that's one option. Another option that is available on the market is something called Repagyne, or Repagyne. I call it Repagyne. And this is a little different. So these are suppositories. So I'm going to just show you what they look like. I'm not going to open it up, but they look like this. They're little, almost bullets. Okay, and what happens with this is you just sort of unpack one of these bullets, insert it vaginally, and you just let that sit there. Again, in the evening tends to be well tolerated for most individuals, and this is it sort of dissolves into the tissues of the vagina and allows for that moisturization to take effect. Okay, this particular moisturizer is good, and I've had really great sort of reviews from clients that I've worked with that use this. There are ingredients in here including aloe vera, calendula. Those have been historically known to help sort of have an easing, calming effect and anti-inflammatory effect to tissues. There is tea tree oil in this particular moisturizer. Some people may have a sensitivity to tea tree oil, so you want to just be kind of careful of that if you do have a sensitivity. I've only really had one or two individuals that have reacted to the tea tree essential oil. But the other thing that's actually included in this, and Renee, this is also for you, is hyaluronic acid. Okay, so hyaluronic acid is a compound that we actually normally produce within our bodies, but especially around menopause, or where estrogen is in decline, hyaluronic acid, we don't tend to produce as much of it. Okay, and hyaluronic acid is a compound that when produced, or especially within the vaginal area, it actually draws water to the tissues in the region, and so that's how it can be really helpful to maintain integrity, lubrication, and flexibility of those tissues. So again, with age, with menopause, we don't produce as much of this compound naturally in our bodies. So adding it in within a moisturizer like this can actually be quite helpful for people. And in some cases, by using it, it can help with a little bit of tissue regeneration as well. Okay, so that is Repagyne. Yeah, great product. Another one that I actually don't use, but I believe this company is from the UK. It is called Yes, and it is a vaginal moisturizer, also in a gel form. This is certified organic. Again, so if you have some sensitivities, it could potentially be a good option. And the ingredients in here, again, there's a little bit of aloe vera, flax extract, no parabens, and no glycerin. So again, can be perhaps an option for people that are a little bit more sensitive. Okay, so that's Yes, and again, more available in the UK and in Europe. The last one I wanted to go over today is something called Zestica. Okay, this, as you can see on the package here, it's a little applicator that this portion is inserted vaginally, and by squeezing the tube, the gel is administered within the vaginal tissues. So this is actually, I really like this product. It's clear, it's non-sticky, it's fragrance-free, it's paraben-free, and essentially very, very few ingredients. This is essentially what they call a hydrogel, and the hydrogel being hyaluronic acid. Okay, so some of you may be familiar with injections that they'll put in the face. I do believe that similar sort of hyaluronic acid components are used on the face. So this is essentially a hydrogel. There's saline and hyaluronic or sodium hyaluronate in it, and by administering it into the vaginal tissues, again, it creates that sort of gathering effect of water and moisture into the vaginal canal. Again, because it is a gel, it might seep out, so using it at night could be the best way. Okay. Another question that I often will get is, how often do I use these moisturizers? Think about it again, like moisturizing your body, your face. You may not have to do it on a day-to-day basis, depending on the extent of dryness and itching and chafing. But some of these products, you want to first of all read the manufacturer's ingredients as well as directions of use on the product. But a lot of them individuals may use daily for maybe the first couple weeks, and when things are starting to feel better, that can be reduced to 2 or 3 times a week. But again, always have a look at the directions of use on the box. So there you have it. Those are just a few of the options when it comes to vaginal moisturizers. Renee, I do hope I answered your question. A lot of lubricants don't necessarily have hyaluronic acid or components that really draw more water and moisture to the vagina. So that, I would say, is one of the main differences. And I just find that the vaginal moisturizers tend to have a little more sort of calming, anti-inflammatory ingredients that can also be quite helpful. Can you make your own moisturizer? I can't really say that I can give you a yes or a no on that. People will experiment and try to make sort of homemade, more natural things that work for them. Okay, but it's important to note too that if you're trying to find the right moisturizer, or you're trying to create something at home. The vagina has a very a range within pH, which is sort of the amount of acidity or the amount of alkalinity within the vagina, and we always want to be aware of the pH balance in the vagina. So most of these moisturizing products are you want to stay within about 3.5, 3.8 to about 4.5 on the pH scale. So somewhat acidic, but not too acidic or not too alkaline. When we start to get a little bit above 4.5, that can create more of an optimal breeding ground when it comes to bacteria in the vagina. So that's something to consider if you are thinking about, you know, using moisturizers or products. You want to ensure that you're maintaining within that vaginal pH balance. Okay. If you have any other questions, please let me know in the comments now. I hope I've answered your questions. Well, we can't really regulate our pH levels per se. We just want to make sure that the products that we're using, there's a question about how would we regulate pH levels. We want to make sure the products that we're using are appropriate to be used internally in the vagina. So you don't want to use something too acidic, but you also don't want to use something that is too alkaline. Now, the one thing I can say about that, Leslie, is around menopause. The pH balance in the vagina tends to shift, and it tends to not be as acidic. So sometimes that can also make some individuals a little bit more susceptible to vaginal infections, and yeast infections, things like that. So that's something to be aware of. But I'd say most of these vaginal moisturizers on the market are maintained within sort of like that normal pH balance in the vagina. Okay. Great. Thank you so much, ladies, for all of your comments and your questions. For those that are not joining us today, or if there are any other questions that come up, please feel free to put them in the comments, whether it be now or later, and I will absolutely make sure to check in on that and answer your questions online at a later date. Yes, no problem. My pleasure for explaining all of that. I hope you all have a great day, and we'll see you hopefully again sometime soon back on this platform. Okay, take care. Bye-bye.